What's happening, brother?
Oh, not much.
Hey, come on in. Have a seat. How you holding up?
I'm good.
Tell me what's going on.
Oh, long day.
Yeah?
Long day, yeah. I'm pretty tired.
How's working out holding up? How you doing for
good.
that?
Oh, good. I'm good.
So tell me about that, what you were saying. You came in here and you hadn't done legs in 2 years, was it?
Yeah, I don't do legs. I don't do legs. And it was starting to become like I hadn't been doing anything. Like slowly over time, the last like year, I'm just like finding myself doing little and littler. Just enough to make me happy that I did something that day. Until I came in here, and now today I was swam 500 meters, did my treads, my crossovers, all that. Then I hit cardio. Tomorrow I'm going to hike, but I wouldn't be doing this like 2 weeks ago.
Well, how were you doing infantry?
Oh, good.
During this,
good.
How did you hold up for that? Went out with that because that's a very physical job.
Oh,
how were you holding up during your infantry stuff?
I mean, it was just pushing through it.
All right.
Okay. Not good. I mean, we didn't do a lot of stuff that really made it bothersome. A lot of the hikes and stuff, but yeah, it's been a lot better now.
All right, good, man. It's good to see.
I'm hitting it. I'm hitting it hard.
I know you told me that.
But in a good way, like I'm just really physical now and really good.
Now you know those discs take a little bit of time to heal up, right?
You know what the thing is? I have a couple very close friends of mine that they've been going to physical therapy now for a couple months. They have bad back problems, bad lower back, and they're at the point where they're going to naval for shots at pain management. And I keep telling them, I talk to them every day, and I was like, brother, if it's what I think it is, if it's subluxation, if you got pinched nerves, like you're in pain, like they can't even bend over. And I keep telling them to come in here. I showed them your video, I did this, that, and I'm really hoping. I said, hey, at least do it for a consultation. At least come in and talk to him. You got to talk to the guy. And
well, the physical therapy is very good when it is for a physical therapy condition. This is one of the problems that physical therapy in general has a very poor success rate with anything spinal related, because most of the problems are not musculature in the spine, but they're disc issues. And so using physical therapy to fix a chiropractic issue is like trying to, nail a screw into the wall. You know what I mean? So it's
stretching a sprained ankle, right?
That's in effect. Now, physical therapy has incredible things, especially when they deal with extremities. They do incredible things, getting people back from like really serious like ankle injuries and stuff like that. But it's really limited. If it's a disc issue, it ain't going to help out. Now, with someone like you, in the field as a Marine, lifting heavy stuff, rucking all the time, carrying ammo, weapons, all that other stuff, muscle, it's very difficult to damage a muscle. It's very different to tear a muscle. I don't know if you saw on Facebook a few years back, or like a year ago, that one guy, he was bench pressing. Oh, yeah. Did you see it? And all of a sudden his chest popped. Serious muscle issue. That's not a chiropractic issue. That's a legit muscle tear. He probably ripped it off the bone. I don't know what happened, but when it comes to discs, you need a specific chiropractic adjustment.
Oh, and I told him, I've been telling them, and I'm like, I just don't see them, having any success, or, they were like, he's like, hey, I'm getting scared. Like I can't even bend over. I'm like, dude, you just need to go in.
One of the problems too is because you really don't own your body right now, is if it gets to the point, they will force you to have surgery or send you home. Like you'll be is that a dishonorable or it's a medically discharge?
Yeah,
or
probably medically separated.
Medically separated, yeah.
Because you can't do that.
If you refuse to accept the surgery, I know. So come on over, let me check your hips. Let me see what's going on over here. Side. Okay, let's set that right. L5, you okay if we do that?
Yes, of course.
Hips are moving okay? That's not your issue. You do have a pretty significant rotation in your ilium, but that's secondary to what's happening at L5. How do I know that? Because I have an L5 issue too, and 80% of the people in here do. It's lying on the right side. Now, you feel strong enough now that you could get back into doing legs, right? It's just that you, okay.
Single leg stuff.
Single leg stuff, right? Exactly. That's what's
Bulgarians. I'm going to slowly, I'm getting my wife on the same program too.
Perfect. Get your kid on it too, because you don't want your kid growing up with low back problems. Good. That's it, Remy. Good. Okay.
rehab program.
Good.
Kind of getting back into things.
Good.
So.
You know enough to do your own stuff, man.
Absolutely.
Now that you understand about the disc concept, you can work that knowledge into your workouts. That'll save you, give you a lot of longevity, still allow you to build tremendous strength.
So much better. Oh, there it was.
Nice and gentle. Nice and...
This next week, I'm going to be just that much better than I was this past week and then the week before, and it's just going to keep getting better. And
other side. Discs just take time to heal, man. There's no quick way to fix a disc. It just takes time to heal. It's just like a ligament. Where you break a bone, it heals in 90 days. Think about it. Bones are made with marrow. They have tons of nutrients in the bones, and the way the bones heal is the bone cells when they heal breaks or whatever or create arthritis, they do it with osteoblasts. The same cells used to make the bone, that's what they use to repair it. It's not like that with the discs. The discs heal with scar tissue, and scar tissue is not as strong. The discs are relatively avascular. There's not a lot of blood flow going there at all. That's why movement is so important to you guys. That's why we try to avoid stretching, and instead of stretching, we get joint motion. Much, much better. So you're healing up really good, man. You've been consistent in your visits. You're doing fantastic.
I'm glad. Yeah, I'm excited to keep coming.
Keep it up, man. You're good to go.
I know if I just keep this, I can disguise the limit for what I can do physically, because then I know I'm taking care of. I'm taking care of my diet, my health, my muscles. Coming in here, maintenance, healing up. I know I can just hammer it down.
It's one of things, you know. Chiropractic is like getting a good nerve supply to the body is like good nutrition. You know, you don't take nutrition to heal your cancer, but you know that your body's going to function better if you do have good nutrition. And the same thing with chiropractic. If you have a clear nerve supply, the body's going to always function better. So your body was still functioning. When you have subluxation, your body can still function, but it functions at a lower level. You were able to perform your work, but you were in pain all the time. You weren't performing it as well. Your sleep wasn't as well. Your lifestyle was affected. You get a better nerve supply, and all we're doing is we're unblocking that nerve where the nerve's being choked off there. We're just unblocking it. That potential, that life potential, it just comes back to the body. And that's why you feel like you were when you're 22.
I want to show that to my buddies. I need one of those, and so I can just show them what I mean. It's hard to watch them not, just struggle, but.
Everybody has their own. Everybody has their own. Everybody has their own course, man. It's nothing like it, man. When I was, and it changed me so much when I had mine. When Dr. Stork gave me my first adjustment, I was. What are you, 28?
Well, I'll be 25.
Or 25. Okay, all right. So I was 28 when Dr. Stewart adjusted me, and I had been to 5 chiropractors before that. And the first adjustment, I was like, I'm not better, but you did something different to me. And it completely changed my understanding of it. When I saw the x-rays, he showed me the pictures, I knew that there was something, it had affected me so much that, I quit my job working in IT and went back to school to be a chiropractor. And I never wanted to go back to school for 4 years. But hey, but it's helping a lot of people else that helped me out, so.
I just feel all that pressure that accumulated over the weekend is gone again.
Little by little, man. Little by little.
It'll heal in place.
Keep it up, brother.
Doc, thanks.
Thank you.
Appreciate it.
Thank you, man.